Adam Goldman, Regional Director of Operations for Marquis Health Services, joins us now. Welcome, Adam. Nice to have you with us.
Good morning. Great to be here.
It's been some great medical advancements in rehabilitative care. I know Marquis Health dedicated to providing the very best of that care, certainly. And I believe there are 9 Marquis Health Care facilities in Massachusetts. Is that correct?
That's correct.
I understand that some of the changes that are being made in healthcare, and in particular your division of healthcare, is that people are beginning to specialize more. Is that right?
That's correct. With the focus on quality care with the Affordable Care Act and with hospitals looking to partner with other providers who they can be sure their patients get the care that they're looking for.
And acute care, in other words, this is when staying at home is out of the picture. This is where you're dealing with patients after post-stroke, heart attacks, that type of thing.
That's correct. It's a sub-acute level of care. It's after the hospital. When patients get discharged, they're looking for a continuation of the type of therapy and the oversight they were getting in the hospital in order to get back home.
Getting back to actually that, as I mentioned earlier, as we started this interview off, and that this gravitating towards specialty care, all of those things that Muggs mentioned, different areas of rehabilitation necessary, you have facilities that do each one of those individually, correct?
That's correct. Our facility in Danvers, the Brentwood, specializes in stroke recovery. We have a physiatrist and a neurologist that sees the patients, which is unusual in the subacute level.
So if you had a pulmonary condition and needed to rehabilitate, you wouldn't go there?
That's correct, although we can take care of pulmonary patients in our Beverly facility. Blueberry Hills. They have a pulmonologist that comes in to see patients, and they have a full-time respiratory therapist.
How much of the family dynamic factors into this? Is it directly, you're obviously dealing with family members?
Absolutely. The communication with families and with patients is paramount, and also in discharge planning for people that are going to go home.
And I touched on this a little in the beginning, of course. How has the Affordable Care Act affected your end of the business?
Really, what has happened is that it's made all of us on all levels of care, whether it be hospitals, skilled nursing facilities like ours, home care agencies, acute rehabs, it's made all of us focus more on quality.
Just curious, the whole evolution of things. How did Marquis all of a sudden focus on Danvers, Beverly, and Saugus, right? Those were your 3, as Dana had mentioned, specialized facilities for different, but how did you end up evolving to this area for those facilities?
Marquis has been around for about 5 years, and they are focused on acquiring facilities that they believe they can create specialty programs in the markets they're in.
The need for the population as well?
Exactly.
Yeah.
And where do your patients actually come from? Are they referrals from doctors or hospitals, or are they direct people that actually contact you?
For the most part, the case managers in the hospital are making referrals to us based on where they feel the patient will do best, both for their rehabilitation and potential to go home, and what's best for the hospital as well in regards to how they communicate with facilities.
How closely do you work with the doctors or the facility that the patient has been referred to once the patient gets to your facility?
That's very important, actually, to ensure that patients through the transitions of care are well taken care of. So we work with the case managers and the physicians at the hospital on transfer for when the patient transfers from the hospital to our skilled nursing facilities, whether it be through electronic communication with a medical record or what we call a warm handoff with the physician to physician or nurse to nurse. And then when we transition the patient to home, we work closely with the home care agency to make sure that transition is carried out.
So there's a constant communication.
Communication and transitioning in, then transitioning out. Is it communication all the way through?
Major points where things have potential to fall through the cracks, and our job is to make sure they don't.
I did a show called the Retirement Radio Show, and I talked a lot about rehabilitative care. I talked a lot about senior care. And of course, the first thing that people would ask me about, money. The first thing people would ask me about insurance, where's the money come from, and what. So I'd like you, if you would, talk a little to that, if you would.
Most rehab stays following an acute stay in a hospital are covered by either Medicare or insurance. So a 3-night hospital stay is required for somebody to access their Medicare benefit in a skilled nursing facility. After that, they can get up to 100 days of coverage under their Medicare benefit for the skilled needs that they have.
And after that 100-day figure, then it's a long-term care facility, and you either have long-term insurance or you would be essentially on your own dime, if you forget the crude way in which I have to put that. But that's exactly what it would be, is that right?
That's correct. But if you qualify for Medicaid, then you can also apply for Medicaid, and Medicaid will pay if you don't have the assets to pay for yourself for continued rehab stay or for long-term care.
And I know that you have people who are dedicated just to dealing with all of that, because, boy, I'll tell you, that's a jungle.
It's
when you start talking about
mountains of it, yeah,
it's a jungle, and it's absolutely crucial that you have. I'm sure that Marquis Health has a number of people that work with these insurance companies, work with Medicare, with Medicaid, to ensure that a patient is getting the very best dollar-for-dollar care.
We do. We have specialists in-house in each of our facilities that are knowledgeable about the different insurances and Medicare and Medicaid. And we also have in our corporate office, we have people to help as well.
Yeah, online. If I logged on to mhslp.com, right, which is your website presence there, what type of information will I see there? Is there a Q&A type thing where some of these questions would be answered on site? Certainly contact information about your 3 facilities in this area?
Yeah, each of our facilities is featured on our company website, mhslp.com. And you can get contact information. You can even contact the facilities directly via our website.
Adam Goldman has been our guest on the program here. He's the Regional Director, once again, of Operations for Marquis Health Services. As I said before, they have 15 overall in the Northeast Corridor, as they call it, which would include New Jersey, Pennsylvania, and Maryland, correct?
That's correct.
And here in Massachusetts, you actually have 5, and 3 of which are in our listening area right here now. And I believe we mentioned them, did we not? The Danvers, the Beverly, which is Blueberry Hill, and then the Brentwood Healthcare Center in Danvers, and then the Chestnut Woods, which is in Saugus.
That's correct.
Yep. Well, thank you so much for being here. Enlightening conversation. It's been fun.
Thank you so much for having me.
Thank you.
Take care, Al.